The stethoscope is simple in design and is pretty easy to use, but it does have some significant drawbacks. For our project, our goal was to make an electronic alternative to the stethoscope, specifically addressing three of those drawbacks: inaccurate sound perception, uncontrollable sound amplification, and the lack of acoustic data collection. We chose those three because they play a pretty big role to hinder doctors' efforts to treat patients. Because the stethoscope can't accurately reconstruct the input acoustic signals every time, doctors have a 40% chance to misdiagnose the patient. And also, if anyone's ever worn a stethoscope and tapped on the diaphragm, you would know that it would generate a super loud sound. Doctors do that accidentally as well, and since they use stethoscopes on a daily basis, they often receive permanent hearing loss. And finally, because mechanical stethoscopes can't record data, doctors don't have data to reference and might be inconsistent in subsequent diagnoses. So to address these problems, we considered the following. Delay and some beamforming is a signals processing technique that allows us to isolate a particular sound source within a noisy environment. And because everything is electronic, we can easily implement some form of volume control and data collection. The end result is RAYO, the world's first beamforming electronic stethoscope, designed to minimize the risk of misdiagnosis and detect heart defects without EKG or imaging. Using this powerful device, doctors can diagnose and provide treatment without having to run uncomfortable tests. RAYO is comprised of a 4-element array that is designed to contour onto a patient's chest, maximizing acoustic coupling and patient comfort. This right here is RAYO's computing unit, which houses all of the computing components. It is the heart of our device. RAYO also features accessible volume control, expandable micro SD card storage, and a 3.5mm headphone jack. A durable flexible PVC cable protects all internal wiring, and provides a familiar touch. By utilizing beamforming technology, RAYO is able to reveal heart conditions that would otherwise be hidden within the noise of the incoming heart acoustic. One heart defect that is often masked by noise is aortic regurgitation. Normally, the heart valve opens and closes to control the flow of blood in and out of the heart. When the valve doesn't close correctly, blood meant to go out of the heart rushes back in. Aortic regurgitation can cause severe heart complications which can ultimately lead to death. It's important to recognize early signs of aortic regurgitation to determine whether or not surgery is needed. RAYO reduces the noise in the incoming heart signal to reveal spectral features associated with aortic regurgitation. By taking a short time Fourier transform, RAYO warns the doctor of potential valve defects. In later iterations, RAYO will be able to detect a plethora of heart conditions. All potential defects found are reported to the doctor using our easy-to-use graphical user interface. This is the future of heart auscultation. Tune into your heart with RAYO.